that my role in healthcare started when I was young, sitting around the dinner table, listening to my mom, who had a very small medical billing company that she started when she had me, so that she didn't have to go back to work and she could stay home and just make a little extra cash. And I would just hear her talk about insurance claims and what she did to get providers paid. Um, so that was just, I think, my first exposure to it. After I went to college, thought I was going to be in sports marketing. I've always been a super active person. I got my yoga teacher training certification and did that throughout college. Also have my personal training certification. So, from a fitness and health perspective, it's always been something that I've loved and have been passionate about. After college, I ended up doing sports marketing. I interned for the Dodgers for a bit and then worked for the PGA Tour. And I just really felt so uninspired. I hated it. I didn't hate it. It just didn't feel like my thing. Kind of had a moment where I was like, you know what? I quit. I'm going to go do personal training and teach yoga. So I did that for a few years. And that was right around the time when insurance started covering substance abuse and mental health services on a facility level. So my mom, who had primarily had her small business in psychology, was in the loop for some of this facility billing that had started to happen, and so she got pulled in, and overnight, this company went from just her and her home to she was having people like come to the home and, work there. And it just grew really fast, and which was honestly really cool and really like just inspiring to watch. And then a couple years into it, it hit a plateau, and she had hired all these people, rented office space, had a company like incorporated, and basically that it had started to like level off and decline. And she's like, I really have no process. I have no idea, like what's going on. I'm losing customers. And I've always been really operational. I've just kind of got that OCD, attention to detail mind, and a little bit of background in marketing. So I said, let me come in for like just a year or so. I'll help you get some processes in place, help you with your marketing, and that'll be that. Um, and within 6 months of just really working like in the business and seeing what my mom and these people were doing to get just individuals who need treatment and who need help coverage, it just like it was super rewarding, and it almost fueled this like love for health in a deeper, more meaningful way
Mm.
than my experience with, training and nutrition and yoga. So that's 10 years 10 years later, I'm still doing it. I'm still really passionate about it. And it really is something that just like feeds my soul. And I think that access to healthcare is something that is so lacking in the US. And yes, maybe we all have access, but I wouldn't consider it a superior service. And I just am grateful that I get to be part of what I like to think of the difference.
Sure. Yeah. And it's so interesting. I host another podcast for entrepreneurs, and what you're talking about is so relevant from that perspective. So many people, they have a passion, they have a desire, and they go into business with that. And the the everyday running a business, scaling your business, putting processes in place, having employees, making sure that you are getting all of the clients that you are serving, meeting all of their needs. It's a whole different thing. And even from me as a speaker, there
Sure.
is a big difference between what happens when I get up on stage and do a presentation about quality healthcare and the day-to-day running of a speaking business. Are two very different
Sure.
entities and two very different skills. So I
Absolutely.
understand exactly where you're coming from. So
Yeah.